Welcome to this webinar on contraception for the female athlete. I'm Jen Mackey, a retired Olympic rower, and alongside me is endocrinologist Dr. Megan Ogilvie and physiologist Dr. Stacey Sims. Megan, there's often a lot of chat around female athletes and contraception and whether contraception is a requirement to be a high-performance athlete. Can you answer that?
I think that's a really good question, Jen, and it's a question I hear all the time. Contraception is a very important thing for all young women to consider and very individualized. There's no right or wrong answer, and the same thing is not right for everybody. There is absolutely no requirement to use contraception, hormonal or otherwise, just because you're a female athlete. There's many different options to consider, and we are not able to make individual or specific recommendations in this video today. What I would really like you to do is take this information and discuss it with your doctor. But some of the things that you might want to consider when making the decision around contraception options are the length of time that you might want to use contraception for, any other gynecological problems you might have. If you've got particularly heavy periods or painful periods, that might change your choice. And any other medical problems that you might have might change your risk profile and also change your choice. So there's lots to think about.
Okay, so not a requirement and something we need to talk to our doctors about if we think we want to be on some sort of contraception. What are our options?
So I've split these options into hormonal options and non-hormonal options. Let's talk about the hormonal options of contraception first. The most common one that is out there and used is the combined estrogen and progesterone contraceptive pill. And colloquially, we all know that as the pill. When the pill is taken very regularly and carefully, then it's very effective. It's about 95% effective. And it contains 7 sugar pills that you can see in those pictures on the right-hand side of the slide. And it's those sugar pills that you will have your period when you are taking those. There is a tiny, tiny increased risk of clot in the legs and the lungs with these medications. It's often not really a concern for a female athlete who's generally a non-smoker and fit and active and not overweight, but it is something to think about. And the options that are commonly available, I have listed on the slide there in New Zealand: the Microgynon 20, the Levolin, the Norimin, and then the other group of contraceptive pills, the Yasmin and Jeanette, are specifically good at suppressing down testosterone. So they're really good to treat acne if that's a concern. The other hormonal options are really around progesterone. And again, a very commonly used progesterone-only contraceptive pill is the mini pill, is what we colloquially call it. And there's 2 types of mini pill available in New Zealand. The Noriday is the lower dose mini pill, and that has a 3-hour window of opportunity to take that medication. In other words, it must be taken within the same 3-hour time period every day for that one to be effective. And the other is Cerazette, which is a higher dose progesterone only pill, which stops women ovulating or producing an egg with each monthly cycle. And the Cerazette has a 12-hour window of opportunity for you to take that medication for it to be effective. And your period superimposes itself on top of these pills. You don't have a 7-day sugar pill time to take, so you don't get a withdrawal bleed at that time. And this actually will stop periods for a percentage of women. And one of the common side effects of this medication is actually a bit of dysfunctional bleeding and spotting. Then we have the intrauterine devices. There's 2 progesterone intrauterine devices available in New Zealand. The Mirena, which is the slightly higher dose one, and the Jadess, which is the lower dose one. These are known as fit and forget contraception. So these can be placed by your doctor or by family planning or by a gynecologist. And then you don't have to think about them after that. the Mirena for 5 years, and the JDS for 3 years. These are now fully funded in New Zealand, so there is just the cost of the insertion costs. And the most common side effect with both of these medications is initially you will get bleeding or spotting for most days for 3 to 6 months after one of these have been placed, and sometimes some cramping. And then periods generally get lighter and lighter. With the Mirena, after 12 months, about 50% of girls won't get a period with one of these inserted. Jardel is also a depot of progesterone in a rod that is placed in the upper arm. Again, this is fit and forget, and this releases a very small amount of progesterone into your system every day. And this stays in your arm for 5 years, and then it gets removed. The most common side effect of the Jardel is dysfunctional bleeding. Depo-Provera is a 3-monthly injection of progesterone, and again, it releases a little bit of progesterone every day. Again, this can stop periods, but the most common side effect can be dysfunctional bleeding. One of the most important things about the Depo to be aware of if you are considering fertility in the not too distant future is that there can sometimes be a runoff interval after the Depo has expired. It can sometimes take 6 to 9 months for menstrual resumption and therefore fertility to return. Not always though, so you can't absolutely rely on that once the 3 months has expired. And then we have non-hormonal options, and there's 2 of these. The copper IUD is actually commonly used by athletes who want to be aware of their own menstrual cycle. It doesn't interrupt your own cycle, so you ovulate and you have periods like you would do if you were using no contraception. This can stay in for 5 years. Sometimes if you have a heavier or more painful period, a copper IUD can make this a little bit worse. So it's important to be aware of that. And finally, of course, we have condoms. And of all the options I've described, the condoms are the only option that is protective against sexually transmitted diseases. And so often it's advised that you use it alongside one of the other methods of contraception. And of course, the condom's only effective if it's used. But if it is used, then we're looking at about 85% effectiveness.
Thanks, Megan. It's good to know that there are options available, and it's definitely not a one-size-fits-all scenario. As Megan pointed out, if you have any questions relating to your own requirements, please get in touch with your healthcare provider who will be able to help you. Stacey, Megan's let us know about some of the options available to us. Do contraceptives affect our training and or performance?
They can in some regards, but what I want people to understand is that there is an incredible difference between training and adaptation that you get through training and the one-off performance on the day. So we talk about it in the fact that when we're looking at training and we're trying to accumulate a certain amount of stress for your body to recognize that stress and get fitness adaptations, that's more of a chronic effect. And hormonal contraceptions can have an effect on that. But when we talk about performance on the day, again, the psychological supersedes the physiological, and there's no evidence to show that either natural cycle or hormonal contraception driven can interfere with performance. So I want people to really understand that when we talk about training, it's in one metric, and we talk about performance, it's in a separate one. So if we go through this and we're looking at hormonal contraception in itself, I'm talking about specifically the oral contraceptive pill that is progestin and estrogen. And when we take it, I want people to be aware that when you have your normal cycle, you don't have a time period where you have a high dose of estrogen and progesterone at once and it tapers off. In a normal menstrual cycle, you have fluctuations, but they're not as severe as when you take a pill containing estrogen and progesterone. So when you take an oral contraceptive pill itself, you have these little peaks and troughs in a 24-hour period, which is why you need to take the pill around the same time of day every day. How this affects training is if we are to come in for a testing mechanism or some kind of performance test, and we take our pill and then go in for the test, we're testing with a hormone profile of elevated estrogen progesterone. But if we take it at night and then we come in the next morning for a test, we're testing in a low profile of estrogen progesterone. So being aware of when you take your pill can also directly affect your testing outcome. When we're talking about progestin only, like the IUD, what happens with the progestin only IUD or even the progestin only pill is we don't have as thickening of the endometrial lining. So in effect, we are not seeing as severe responses from the progestin and estrogen, because the progestin of the IUD, the progestin of the mini pill, they don't have as a great systemic effect as something like the oral contraceptive pill progesterone component. And I'm really trying to answer questions quickly that come to me with regards to performance and training using these different contraception methods. And I want people to also understand that when we're talking about effects on training and performance, most of the research has been done on the combined oral contraceptive pill. And when we're looking at the training effects of the combined oral contraceptive pill, these are some of the things that we found that if you're going to achieve that top level of being an elite athlete, or you're looking for that top end capacity, there are some negatives of taking the combined oral contraceptive pill. We know that the estradiol and the progestin component can directly affect things like how much oxygen your body can take in at one time. So that's your VO2 peak, your top end capacity. It affects how much blood is pumped out with every heartbeat or production. We also know that it slows the rate of anaerobic adaptation. We also know that it downregulates IGF-1, so it can have some effect on bone formation, which can be a concern if an athlete has a predisposition for stress reactions. We also know that the higher dosage of estradiol in the combined oral contraceptive pills, so the 30 microgram dose, is also associated with increased oxidative stress and inflammation. And being aware of that, because that means you had to factor in more recovery. It is just being aware of these little things that the combined pill does, just to be able to adjust your training to get the best benefit out of what you're using and out of your training itself. We also know that specific to the formulation of the combined oral contraceptive pill you're using, the higher the progestin activity, knowing that there are different generations of progestin, and this is something you'd want to discuss with your physician, that if you have a higher activity of progestin, then it decreases the amount of protein synthesis, muscle mass synthesis. So again, you have to look at training dose if you are using a higher progestin activity, because you'll need more of a training stress to get the same adaptation. We also know that with a 30 microgram dose instead of a 20 microgram dose of estradiol, or the estrogen component, we can see an increase in the muscle fiber, but there isn't an increase in strength to go with that. So this can also be a performance concern for individuals who are more power to weight oriented, but it might not be such a concern for those who are not so tied to power to weight. So again, these are just concerns that have come up through the research that you might want to be aware of if you are working towards that higher elite aspect for being an athlete. One of the other things that we need to be aware of is how these pills can affect our recovery. So this is a schematic of heart rate variability, which is something that coaches really understand, and it's a measure of how well you recover. We know that with no hormonal contraception at all in your normal cycle, there is a variation in your heart rate variability, that as you go through your cycle, then you have a decrease in recovery. This is normal. When we look at the combined oral, a different pattern, where in the early, or when you first start taking the active pill, you are compromised a little bit in recovery. The second week of the pill, you're seeing more of that effect. In the third week, your body is stabilized, so it's not quite as strong as your natural cycle. So there's a little bit better recovery. And then when we get to the first few days of the sugar pill week, we see that you have even better recovery options as compared to someone who is in the few days before their natural period starts. So being aware that these are different changes to be able to work with your coach and understand how you're recovering. The progestin only has a different pattern again, where it follows a similar recovery metrics as your natural cycle until we get to the late luteal phase, where you have better recovery on that progestin only. So again, being aware that the formulation can directly affect some of your recovery metrics. So it's being aware of what you are using and how that might affect your recovery, and being able to understand how that might affect your training adaptation. And this is the last schematic that I want to show. Again, trying to understand how these contraceptions can affect adaptation and recovery. When we look at a progestin-only hormonal contraception, and we're looking at recovery, we see there's really fantastic recovery in the early follicular phase, and we can adapt to a lot of the stress. But as we get further into the pill use, we're finding that just like their natural cycle, we're having less of recovery and we are having greater strain. The pattern with a combined oral contraceptive pill is different again, where there isn't too much of a difference between the amount of strain and recovery. So understanding that you will need a little bit more recovery between high in order to get the adaptations your body is after. So it comes down to really that we have these different molecular structures. So this is your natural estradiol, your natural hormone. And we look at what's happening with the different molecular formulas of the contraceptions, it has to do with these hydroxyl groups. And these are the reasons why we have these different responses. It doesn't mean it's necessarily a bad thing. It's just being aware that what you're using can have a little bit of effect on how your body's adapting to the training. So understanding what you're using and being able to convey that to your coach or have that discussion with your physician is going to allow you to make the wisest choice for what your goals are.
Thanks, Stacey. That brings us to the end of this webinar. As I think has been highlighted, there's a lot to think about in the contraceptive space. Your healthcare provider will be able to give you advice with regard to your situation, so please reach out to them if you have any questions.